Hi, everyone. My name is Ben.
I'm Gabe.
And I'm Ava.
Our problem title is a bidirectional GRU to classify ECG abnormalities. So in the United States, heart disease is the leading cause of death for nearly every demographic group. And ECGs are the first line of detection for many different types of heart disease, such as heart attacks or heart failure. And the issue with ECGs is that the baseline accuracy of ECG interpretation is pretty low among physicians and medical students. It's only around 54%. So there needs to be a better way to classify heartbeats from an ECG. So we found a data set from Kaggle, which has 110,000 beats from 47 patients, and each beat has 187 measurements, 187 amplitude measurements, and it's padded with zeros at either end. There are 5 classes, and as you can see, there is a pretty significant class imbalance with a lot more normal beats than abnormal beats. It's also important to note that the unclassified category represents beats that could not be identified as one of the other categories. So they're all unclassified beats are lumped in there. The correlation matrix here shows that there is a temporal dependency in our data, which lets us know that we can use a model that is known to evaluate time series, which is one of the reasons we chose a bidirectional GRU. And you can also see the average beat per class in this bottom left graph here.
So as for our baseline model selection, we decided to focus on F1 score to include both precision and recall because while we want to make sure our predictions are accurate, we want to make sure the recall is low because misclassifying a abnormal beat as normal is what we want to avoid the most. So as we look at the models we trained, we did grid search, a little grid search hyperparameter selection for each model to optimize the baseline models. We found that the KNN with 3 neighbors and distance weighting was by far the best with an average F1 score of 0.9754. And that was our selection for a baseline model to compare the bidirectional GRU with.
Yep. So as we said, our model of choice was a bidirectional GRU. So we chose this model. The GRU can use the gating as an LSTM would, but it is more efficient than an LSTM, so it can run quicker. And we use bidirectional because the data is time series, but per beat is a very short time interval, so you can get real-time evaluations, but gain the information from both directions. So as for our architecture here, you can see we did a 3-layer bidirectional GRU. Each layer had 128 hidden nodes, and one of the main features of our network that was the most helpful for improving the F1 score was we used zero masking pre-processing with mean pooling over the non-zero timestamps. And masking this way allowed us to identify the lengths of each beat, which was very different across classes, and also allowed us to see where the information began over the time interval, which was also useful information to help identify across different classes. We did 25 epochs, but we used early stopping with the validation set to prevent overfitting. And also this allowed us to get updates as we were going along and choose the best model instead of the last model. We used an atom optimizer, and we used a plateau scheduler with a patience of 2 so that if the learning rate was too high and we started to see a plateau in our accuracy and our F1 scores, then it would drop the learning rate. And at the end, we used dropout just to ensure that this model would generalize well to new data.
And as for comparisons to the baseline and their evaluation procedure, we can see that across each class, the F1 score of the bidirectional GRU was higher. And then overall, the average weighted F1 score was also higher. And we can also see the confusion matrix there. And so at least on our original data set, the bidirectional GRU was performing much better than, or marginally better than the KNN.
And we also tested it on the MIT BIH supraventricular data set, which is a data set that was constructed based on a very similar study by the same lab, but on entirely new participants. And with this new data set, we saw that the KNN model gave an 85% F1 score, whereas our BIDE-GRU gave a 90% F1 score. So we continued to see the improvement in the new setting with new data. All right, thank you.
you.